Hello, Hello, everyone. Good evening, everybody. And I'm Dr. Bona Raval. And on behalf of IIP Digital Media Team, I welcome you all to today's webinar. It's being celebrated as the 70th anniversary of the World Physiotherapy. So, with the theme Long COVID and Rehabilitation, we are here with the topic COVID-19 and intellectual disability and its impacts and solutions. Um, this webinar was organized by IAP Women's Cell Bihar branch, and it is being live streamed on our Zoom and official YouTube channel IAP India. So to remain updated with the latest news and webinars, you can please like and subscribe us on all our social media platforms. And now, without wasting much time, I would like to hand over the session to Dr. Smita.
Thank you so much, Mona. Well, every year, 8th September is marked as World Physical Therapy, which is an opportunity for physiotherapists from around the world to raise awareness about the professional community to keeping people safe, mobile, and healthy. Well, in 1996, the World Physiotherapy Day was declared to be 8th September. This is the date of the establishment of World Physiotherapy in 1951. The day marks the worldwide physiotherapy community's unity and solidarity. It is an opportunity to appreciate the work physiotherapists do for their patients and their societies. World Physiotherapy Day is an anticipation that strives to encourage and strengthen its knowledge in member organizations. This year, the theme for World PT Day 2021 is focused on the last year theme, that is rehabilitation and long COVID-19. Physiotherapists play a key role during the coronavirus pandemic in the protection of the health and security of individuals and society all over the world. Well, God lives, feels, and suffers in every one of us. And in course of time, his attributes, knowledge, beauty, and love will reveal in each of us. Teaching is the most impactful job in the world, and knowledge gives us power. Love gives us the fullness. Great leader, philosopher, and guide, Dr. Sanjeev Kumar Jhasar is here with us on the occasion of World Physiotherapy Day to guide us. Welcome, sir, and a very good evening to you.
Thank you, Dr. Smita ma'am and whole IAP Women's Health team. And I also congratulate Dr. N.K. Sinha and the state team for being present here. And to everyone in IAP Bihar and around that, a very happy World Physiotherapy Day. I think we have already fulfilled by organizing thousands of programs and camps and seminars all across India. So it's a very nice feeling that I can see that everybody is reaching to the root level to see to it that the message of physiotherapy reaches to the common community. I really appreciate the presence of Donna Bridge ma'am, and I feel her presence will furthermore enlighten us, and not only enlighten us, but it will also enrich us in knowledge. And having such a great personality on our platform, it's a really commendable effort from the IAP Women's Cell Bihar branch. So yes, from the side of the Central IAP and IAP India, I really welcome madam, and I'm very grateful to you for joining here on this webinar, and we will be looking forward to you for further future programs as soon as possible. So without taking much time, I really congratulate each and everybody, and also those who are participants and those who are listening to this particular program and webinar. All the best from my side, and happy World Physiotherapy Day again. Thank you.
Thank you so much, sir, for such an overwhelming words. Sir, you are the educator who have been the driving force in our lives. Thank you so much, sir, for sharing with us your words of wisdom. Well, she believes hard things are put in our ways, not to stop us, but to call out courage and strength. Dr. Ruchi Vashne, ma'am, National Head IAPWC Cup Treasurer. Welcome, ma'am,
Thank you, ma'am. Good evening, one and all.
and very good evening to you.
Thank you.
Ma'am, over to you, ma'am.
Acha. Okay, good evening. Good evening, Donna, ma'am. Good evening, Sanjeev Jha, sir, NK Sinha, sir, our zonal head, Reena, ma'am, Josni, ma'am, and all the participants of the webinar and all those who are watching us live on IF India YouTube channel. I would like to wish you all a very, very happy World Physiotherapy Day. Last World Physiotherapy Day, we were all locked down, and now the lockdown has started, being unlocked, and it's a new normal that we all are in. And the topic of the webinar is something which we all are looking forward to. And then, moreover, I would like to add that this intelligence, I think the COVID has changed the dimensions. COVID-19 has changed the lookout of the people as far as the technology is concerned. There are things which we were not doing, now we are doing, meaning connecting Delhi to Indore to Bihar to, anybody, anywhere in the world together with this connection. And I guess we need to work on it more. I guess we need to prove a physiotherapy profession, take it to this direction as well, being more, technical entrepreneurs also we can get out of this team. And thank you, Donna ma'am, again for your, like always, I think you have supported Women's Health always and given us your valuable time. And I wish all the physiotherapists of the country a very happy Physiotherapy Day. Thank you to Smita ma'am for your undeterred spirit. You always believe that, I tell girls to dream big. And then when you dream, then give wings to it. You already have the wings, ma'am, and you are flying all across. I wish you all the best. I wish you all the luck. And I'm sure that you will do wonders in your life. Thank you so much once again for inviting me. Thank you, ma'am.
Thank you so much, ma'am. Ma'am, you have graced us with your presence and guidance, and we are actually flourishing with you and under your guidance. Thank you so much, ma'am. Well, we know that individuals with intellectual and developmental disabilities are submerged under populations articulated by the World Health Organization and the Centers for Disease Control and Prevention to be at increased risk of infection with and complicated outcomes from the novel coronavirus. Surveys and researches have proven that having an intellectual disability was the highest independent risk factor for contracting COVID-19, controlling for race, ethnicities, and other variables. Those with intellectual disabilities were 6 times more vulnerable for COVID-19 rather than other members or other population when we talk about. And basically, the goal of this communication is to provide clinicians, physios, and behavioral scientists with the scoping perspectives on the diverse era of effects of the COVID-19 pandemic on individuals with intellectual and developmental disabilities in the world. It is our hope that this webinar will stimulate subsequent health team and advocacy efforts to ameliorate the disproportionate burden of the pandemic on people with intellectual and developmental disabilities. Well, today we have with us a lady who believes that the human spirit is one of ability. perseverance, and courage that no disability can steal away. She has devoted her life for special kids, a well-known figure around the globe, and my ideal too. Dr. Jonah Bainbridge, PT, EDD, and she is a retired CIFT Doctor of Education now. She is a Special Olympic Global Advisor for Fun Fitness. She's a chair, World Physical Therapy Network on Intellectual and Developmental Disabilities. She is an adjunct clinical professor, University of Montana, College of Health Professions and Biomedical Sciences, and also consultant at University of Montana Rural Institute on Inclusive Communities. And her topic for talk today is COVID-19 and intellectual disability, impacts and solutions. Well, disability is a matter of perception. You can do just one thing. Well, you are needed by someone. And for me, disability is a way of getting some extremity, some kind of very difficult situation that throws an interesting light on people. Very welcome, very warm welcome to Dr. Donna Bainbridge. Ma'am, good evening and good morning for you. Over to you, ma'am.
Thank you very much. I appreciate all of you being here with me to address this topic. I will start by saying that most of the information that I will present today is new and hot off the press. There has not been as much research done or as much data collection done on people with intellectual disabilities. So as unfortunately the COVID epidemic progresses, we will get more and more information. We have very little, if any, information on long COVID in this population. So I will mainly address COVID-19, and we will look at the impacts of COVID-19 on the population, as well as some of the solutions that we have begun devising to address these issues in this population. So as was noted by Shmita, people with ID are much more susceptible to not only the physical, but the mental and social effects of the pandemic. Medical care for these individuals in many parts of the world is much less available, especially if we present care in a virtual environment. We have in the past always actually cared for these people in physical reality. And now we are actually forced to begin looking at how we can care for them in a virtual manner. So this is a whole new world with this population. People with ID may not be able to accurately relate symptoms or exposures to their carer and their physician. They may not understand what their symptoms mean. They may not know if they've been exposed to COVID-19. We know, unfortunately, the vaccination is less available to this population. And if it is available, it may not be available in as much of a timely fashion. And a lot of people with COVID-19, like the general population, may have vaccination hesitancy or fear of vaccination. So what do we know about the prevalence of COVID-19? Having as an intellectual disability was the highest independent risk factor.
Donna, I'm so sorry
Yes?
to interrupt in between. Could you please share your screen?
I am. Let me try again here. Is it sharing?
No.
It was before. What happened here?
You just click on the share screen option at the bottom
I
of the
did.
screen.
Yeah. I did click on that, and now I clicked on share screen and nothing happened. Did it share or no?
No.
All right, well, I'm clicking on share screen and it doesn't seem to be sharing. How
Yeah.
about that? Ah,
Yes.
okay.
You're here.
Okay. Okay.
Yeah.
Yes,
So,
ma'am.
yeah. Okay. So having an intellectual disability was the highest independent risk factor for developing COVID-19, if you control for race, ethnicity, and other variables. People with intellectual and developmental disability had also a higher prevalence of specific comorbidities that were associated with poor outcomes from COVID-19. There are age-related differences in the trends amongst those with COVID-19, however. So if we look at the trends, we can see that people with ID are 6 times more likely to die from COVID-19 than other members of the population. The overall fatality rate, if you look at all ages, was similar for those with ID and without ID. However, if you look at those fatality rates by age, you can see that there are differences. Under the age of 17, people with ID die at a rate of 1.6%. Without ID, it's 0.01%. So much higher in the younger population. If you look ages 18 to 74, those people with ID die at a rate of 4.5% compared to 2.7% for those without ID. Interestingly, in the older population, which is the population that we often worry about over the age of 74 years, those with ID and without ID have more similar rates of death, although those rates are very high. So with ID, the rate is 21.1%. Without ID, it's 20.7%. So what this tells us is that the older population, although the death rates are similar, die at a much higher rate than the younger populations. But within the younger populations, those with ID die at a higher percentage than those without ID. The physical risks to people with intellectual disability from COVID-19 are higher rates of infection because they often have physical health problems prior to getting COVID-19. They may have poor social circumstances, which will allow them to be more susceptible to the physical effects of COVID-19. Or they may have lack of understanding of how to manage their disease, which will give them a higher physical risk. Many people with intellectual disability have the disability from a genetic defect. They also have comorbidities that go along with the cause of their intellectual disability. For example, heart disease, that make this population at higher risk for getting COVID-19 and for getting more severe COVID-19. The other complicating factor is that the people with intellectual disability often develop more secondary conditions, such as obesity, diabetes, respiratory disease. And these factors, in addition, put them at much higher risk for COVID-19. So their social situation, their comorbidities, and their secondary conditions, all three of these create higher physical risk, greater disease, and higher mortality. We need to also look at social and environmental risks. Often people with ID live in supported or congregate environments, which increases their risk of exposure and their risk of transmission of COVID-19. They have daily contact with support personnel to help them manage life, and that again further increases their risk of exposure. What we've seen in this country, because there are many people who do not want to get vaccinated, is that if they are exposed to people that they live with or who take care of them who have not been vaccinated, then their exposure rate goes up even more. There are many social behaviors that they have, some positive like hugging, some negative social behaviors like spitting, that may again increase their risk because they don't understand that those things may spread COVID-19. Some people in many parts of the world suffer from poverty and food insufficiency and security, which further increases their risk for disease. So we need to look at physical risk and the social determinants of disease that increase their risk even further. Finally, they have risk because of their cognitive and mental status. Their needs to shelter at home and everyone's needs to stay home and lock down may create anxiety and stress in people with ID. We've seen this specifically in people with autism, spectrum disorder, and other types of mental illness that are associated with intellectual disability. And they become more anxious and more stressed in the home environment when they can't get out. Their cognitive limitations and their issues with memory may make adherence to safety routines and public health directives very difficult to follow. They may not understand, they may not remember how to follow the safety measures. Many people with ID do have a lot of difficulty advocating for themselves. And so they may not be able to advocate for their personal needs. Understanding the importance of all these public health measures might really be difficult for them. And therefore, because they don't understand, it will be difficult to enforce them. So if you tell them to shelter at home or to wear a mask or to stay 6 feet away from someone else, they really may not understand why that's important, or they may forget to do it. Much of the information about the pandemic is quite complicated, even for the general public. And for people with intellectual disability, it's even more complicated, and they may have no understanding of what people are talking about. Because the pandemic came upon us in such a quick fashion, we haven't had time to really formulate materials for populations with cognitive impairments. And so they often are at a huge disadvantage because they just don't understand what is being told to them. So I have on this screen on the right-hand side a piece of material that was developed by Special Olympics for people with intellectual disability. And it summarizes some of the issues related to ID that put people at ID at higher risk for COVID-19. So beyond what we've talked about so far, in many places, including the United States, they have less access to healthcare. The other big problem is knowledgeable professionals to treat them. People don't understand intellectual disability and the issues that come with intellectual disability in the normal environment, let alone with COVID-19. The other issue is lack of financial coverage for adequate care. Many of them don't have health insurance, have state-based health insurance, and so the financial coverage for adequate care for them is often lacking. Many of them lack transportation so that they cannot get to the doctor or the hospital if they need to go. And so this can be a large problem. And many of them have poor diet and hygiene, which exacerbates the problems of COVID-19. The other thing that I think we need to look at that has been not really looked at as much as it should have been, the intellectual disability during the pandemic. We know historically that carers of people with any form of disability do have higher stress and poor health conditions. But what has COVID added to this problem? There's been a little research done that show that families do experience stress with the COVID-19 epidemic because the normal support services that assist them are often decreased by the need to shelter in place. So if a family has a caregiver who comes in for so many hours a day, that caregiver may no longer be able to attend, and therefore the burden falls entirely on the family. Families may bear significant financial strain if they're forced to stay home and provide care, or if they lose their job. And so many families have either lost employment or been forced to stay home to provide care so they cannot go to a job. And that causes huge financial stress on the family. The other problem is the mental stress now is significant because the care is 24/7. If they have no one helping them, they're caring for the person 24/7, 7 days a week. And so this causes a lot of mental stress. The other piece of research that was interesting looked at changes in stress levels based on other factors. So they showed that stress was higher if the age of the parent was increased, if there were changes in working condition, if you looked at the total number of stressors. So if they had loss of work, loss of assistance, they themselves had an illness, if you added those stressors up, the more stressors they had, the more stress levels went up. The other thing that has created a lot of stress, and I can say this for the United States especially, is distance learning. We had all of our schools closed down and all the children were learning at home. And this was a huge new experience for many families who had never done distance learning, may or may not have used computers and computer-associated learning. So that was a huge stressor and a huge time-consumptive stressor because it took a lot of time for people to work with children. This was especially true if they had a child with a disability and also children with no disability. So what I'd like to show you is, and I was thinking of the comment that was made before about us going into technology and the internet and how that has impacted how we provide care and information. So I wanted to actually look at some of the solutions that we've begun to develop for both families and for professionals. And this is a brave new world for us because in the past, very little has been done with people with intellectual disability with technology. And what we've discovered as we've kind of advanced into this world is that it has to be presented in a certain way. Not everyone has access or good access to the internet. If they're using phones, it changes the size of what you're showing them. So there have been a lot of technological challenges in this process. So these are a few guidelines that we've discovered. There are very few guidelines about how to create materials for people with cognitive impairment. And these are a few of the guidelines that we use as we try to prepare our materials. Number one, use a large font size, at least 14. Do not use all capital letters because that is very difficult for people with cognitive impairments to read. Use what we call plain language or simple language. So, for example, use the word infect instead of contaminate, which is a much more complicated word. Use graphics and pictures instead of always using words. Try to use only a few colors to highlight key areas, and use as simple of an instruction as possible. So, for example, turn on the water before you soap up. And I'm going to give you lots of examples of these. So here is a piece that was done by Special Olympics to explain what coronavirus is, how it spreads, and how to protect yourself. And we don't need to go through this entirely, and I have the links here so that you can actually access this and use it if it would be helpful for you. But you can see on this page that on the top part where we have symptoms, we have lots of pictures of coughing, shortness of breath, fever, muscle pain. So every word which is a symptom has a picture associated with it, so that for people who cannot read, they can look at the picture and understand. The second section is how it spreads. And again, pictures are associated with words. And the last section, how to protect yourself, again, pictures associated with words. Now, I will comment that I think this piece of information, even though it's following some of our guidelines, is still not easy to understand. And a lot of people with intellectual disability would need someone to work with them to read this. But this shows you how we can simplify an action. So I have a couple of examples in here of hand washing. So this was done by Special Olympics Australia, and it has on the top, the goal is to have clean hands and prevent spread of germs. And that's simple language. Then on the left-hand side, why is it important? And they have a picture of soap. In the middle, in the steps to how to wash your hands, it's all pictures. So most of the words are there. Wet your hands, apply soap, wash your hands for 20 seconds, rinse, dry. Turn off the water with the towel. But each one has an associated picture. And then they tell you when to wash your hands. And then they tell you how to know if you've done it for 20 seconds by singing happy birthday twice. This is another example, much simpler, done by Special Olympics British Columbia. So this simply shows the task, washing your hands with soap and water for 20 seconds. So even though this is simpler, it doesn't give you as many tools as the previous example. But this could be used for someone who has a lower level of understanding. So this gives you an idea of how you could take the same task and create it in several different ways for people with different levels of understanding. This one addresses how to correctly wear a face mask. And this has been a huge problem in the United States, even amongst the general population. You'll see people with face masks on and it's down under their nose, which of course is the most contaminating part of the disease. So this shows you a do and a don't. Do, it shows you from the front and the side how to wear the face mask over the nose and mouth. And then the don'ts, it shows you to cover it. The first one, the mouth's not covered. The second, the nose isn't covered. The third, they're putting the hand on the mask. And the fourth, the mask is down under the chin. So this is very effective because it shows you how to do it and how not to do it with no words at all. The other big issue with everyone is vaccine information, or as we call it, disinformation. We've had a lot of information, as I'm sure you have, and disinformation and conspiracy theories circulating online and in print regarding vaccination. And the population of people with ID and their families or caregivers may not have really good access to vaccine information that's correct. They may also have a lot of apprehension about the whole idea of not only vaccination, but getting a shot. And so we have, Special Olympics has actually created a nice flyer that was only in PDF format that goes through all of the myths about vaccination and tells what the truth is. So I would encourage you to take a look at that because it's really very helpful if you're in a situation where you need to get vaccine information out there and also get rid of some disinformation about vaccination. The other thing I wanted to address was advocacy. We have had some difficulty both around the world and in this country with advocating for people with ID to get vaccinations, to get people with ID on those early vaccination lists. And the problems with this are that people with ID are recognized and included to various degrees around the world in the considerations of who gets vaccinated. In many countries, people with ID are unseen, uncounted, and really not accounted for well in emergency situations like COVID-19. Vaccination programs may not account for or extend to people with ID. And so we have to really advocate, and this is really a job of the healthcare professionals and families and caregivers, to try to get people with ID on those early vaccination lists. And I think this largely falls to healthcare professionals because we have the most information, we have the loudest voice, we know the people to contact. So in each community, I think it's the responsibility of the healthcare professional to talk to the governments and the policymakers to make sure that when they're making up the list for who's going to get vaccinations first, that we make sure that people with intellectual disability are recognized as a group at risk and get on those early vaccination lists. We also need to make sure that they set up vaccine clinics that are accessible and available to people with intellectual disability. So Special Olympics has created a flyer that goes through the reasons for and how to achieve vaccination equality. They've also created a global health advocacy toolkit for persons with intellectual disability. And that toolkit is very helpful if you want to work in your community or go to your government in terms of advocating for people with ID. We also have some YouTubes on the website that were created by our health messengers. And they are athletes who have been trained to give health messages to the world and to other athletes. And they're often very impactful if you're trying to convince people with intellectual disability to get vaccinated. Because now you have another athlete with an intellectual disability speaking to them about the value of vaccination. We also have created some online training opportunities. And the first opportunity is that we have created an online learning portal. And that learning portal is training for professionals. So we have coaches, fitness professionals, health professionals can go on this portal. And I've got the link there. I've also got how you register to get onto the portal. And this walks you right through the registration. These courses, which address things like what is intellectual disability, how do you best communicate with people with intellectual disability, are all available free of cost. So they are great sources of information for professional volunteers, for students, for people who have not really had a lot of exposure to people with intellectual disability, to learn more about intellectual disability. We also created a specific COVID training, and I have the link for that. And what that does is goes over the impact of COVID-19 on people with intellectual disability, how to work with them in a medical setting, how to best communicate with them around COVID-19. So this slide and these resources are for students and professionals. We have also created opportunities for the athletes and their families. We can no longer do any of our health screenings in actuality because of COVID-19. We were getting to the point where we were just reconsidering going back to them again when the Delta variant hit. So we're back where we were before. I don't think there's anyone who's doing anything in actuality now. And we just had our World Games postponed from January of next year to January of the following year. So we've even had to postpone the Olympics. But we were looking for ways before COVID-19 to try to expand our reach outside of the in-person screening events, because not always can everyone attend. And so we were beginning to look at some other options for how we could interact with a larger population of people who might not actually be able to come to our screenings. And then COVID-19 hit, and it was a tipping point. This made in-person screenings impossible. And so we had to look to virtual opportunities. So the first thing we said was, what will be the value of them? We could maintain, hopefully, or continue to improve the fitness of our athletes for both physical and emotional social health. So we're looking at fitness as both a physical issue and a social emotional issue. We could also help educate the athletes more about fitness. We could use this opportunity to not only hopefully make them more fit, but to teach them more about fitness. We always make the assumption that we say you need to be fit and they understand what we mean. But do they really know what it means to be fit? Do they really understand what fitness is? So we could use this as an opportunity to expand that knowledge. We could also use it as a way to keep our volunteers and our students involved. If we could develop some systems where volunteers and students could work with athletes in a virtual way, it would keep them involved with the movement. So we developed two opportunities. The first was fitness education. So we worked with Special Olympics fitness team, and we created an interactive PowerPoint that would introduce them to fitness and be a context for the Fun Fitness screening. This PowerPoint gives them an overview of fitness. It covers the different components of fitness: flexibility, strength, balance, and aerobic. And it covers why these components are important. So we explain what they are and why they're important to fitness. So that's the big part of education. This PowerPoint is interactive. We're not just talking to them like I'm talking to you now. We ask them questions, we have them respond, we give them chances to talk to us about what they do. So all these PowerPoints are very interactive to keep them engaged while they're on the phone. We also include sample exercises, and we have a program called Fit5, which I've put the link for, which is a nutrition and physical activity program that they can link to and get a whole series of exercises about stretching, how to get stronger, how to improve your balance. So this is one of the opportunities that we developed. And we developed one overall fitness preview, and now we are developing separate interactive PowerPoints on each of the elements. So we have a separate one on flexibility, a separate one on strength, a separate one on balance. The second thing we developed was Fun Fitness at Home. So Fun Fitness is our fitness screening that we do at games events that actually has physiotherapists and students measuring the components of fitness through a series of evidence-based tests. So we said to ourselves, how could we do some of this fitness screening at home? What could we do that's simple enough and safe at home to be done with the athlete and a caregiver or a family member? So what we developed was a series of simple tests for flexibility, strength, and balance that an athlete and a parent or a caregiver could do at home. After they do the screening, there's an individualized education session with a physical therapy professional to teach exercises on areas that need improvement. And we can use this as not only a baseline, but we can monitor their fitness by doing this again in the future in 3 months to see how they're doing. So the comparison of these two, the education piece that I talked about, you can do with a group of athletes. So it can be interactive education center with a group of athletes, with the team of athletes. It can be led by physical therapists and or students. It can also be led by other healthcare professionals. We've had a few sessions that have been led by fitness trainers or exercise physiologists, sports therapists. And then this can be an introduction to doing Fun Fitness at Home. Fun Fitness at Home, on the other hand, has to be done by the athlete with support of someone, or by the athlete with a physical therapist volunteer, simultaneously doing the tests with them. These are individual encounters. So these are a lot more time consuming. They're a lot more personal, but they're also a lot more time consuming. So each of these takes about 45 minutes, and you have to have a therapist or a student working with the athlete. So just to give you an example, these are the tests that we do in the screening at home. And we've done these in this order because you get on the phone with the athlete or on Zoom and you set up their camera. And so what we've done is try to do this so they set their camera up one time and they don't have to keep moving the camera around. So these are the tests that we do in the order that we do them so they don't have to move the camera. We're doing the timed up and go test, the timed sit to stand test. So timed up and go is a balance test. Timed sit to stand is the strength test. The modified chair sit and reach is the flexibility test, as is the Apley. Single leg stance, eyes open, because that's the only safe way to do it at home, is the balance test. And the time partial sit-up is the strength test. We also have tests for athletes who are in wheelchairs, which would be a seated functional reach test, which is balance, and a seated push-up test, which would be strength. These are all on the website. So I put this page in there so that you can go to the website. We have a manual for the athlete and caregiver. We have a manual for the program and the clinical director or the physical therapist. We have a screening schedule and a data collection tool. We have the PowerPoint. We have a fitness handout. And we actually have a video of doing fun fitness at home so that you can actually see how it is done. So all these resources are available. We have had more use of the PowerPoint presentation than Fun Fitness at Home. But we've had a few states and countries start doing Fun Fitness at Home with a group of athletes and a group of therapists, and they're all working simultaneously in different rooms. So we're beginning to see some innovative ways of using this. We have, I think, developed the system so that they are understandable to the athletes, but I think we're still in the process of scaling them up to be more utilized by athletes. The last thing I want to mention is return. Eventually, the pandemic, we hope, will calm down and we will be able to return to both screenings and sporting events. But we felt it was important to develop some guidelines for how to return. So we have developed return to screening guidelines for those programs who are able to provide actual screenings again. And I mention this because these same types of screenings could be physical therapy appointments or doctor's appointments. So although we've used these guidelines to return to screenings, the same guidelines could be used in essence for how and when can I return an athlete to actually going to the doctor or going to physical therapy. And so I mention these just because I think they have a larger utility than just returning to health screenings. We have done discipline-specific screenings. So for Fun Fitness, we've added to the return to screenings guidelines for our discipline. And I think, again, you can look at those and use those in a larger sense for returning to healthcare. We have a COVID toolkit that that has both education and advocacy materials. The education toolkit is for families and caregivers. The advocacy toolkit, as I mentioned before, is for programs, and they're both listed at this resource. The last thing is returning to activities. You know, for our athletes, this is the most important thing, is when can they return to sports? And so we've created return to play guidelines. And these, again, could be used for you, by you, for how are athletes going to return to the outside world, to engaging in activities. These are minimum guidelines. They are intended to supplement any laws, rules, and regulations with which you must comply. We also advise you to seek information from health professionals and public health officials if you have specific questions. And there's always the question of liability. So this is the link to those return to activity guidelines. And I think that's enough information. So I will open it up for questions at this point. And I've also put my email here in case you want to email me with any questions.
Thank you so much, Donna. Well, I think Joshni ma'am, you are having some questions, right? You can straight away ask. Joshni ma'am?
Yes. Am I audible?
Yeah.
I just wanted to ask if she can give some examples of certain screening tests which commonly they are using virtually, like from a distance. Few examples of screening tests.
So you want screening tests that we're doing virtually or that we're doing actually?
No, virtually. Actually.
Okay, so when we do our virtual screening, Fun Fitness at Home, we do timed up and go test and single leg stance test with eyes open for balance. For strength, we do the partial sit-up test and the sit to stand test. And for flexibility, we're doing a seated chair sit and reach. And the Apley test, which is a test of shoulder rotation. So it's when you put your hands behind your back and try to touch your fingers together. We chose not to do the aerobic test because we felt that that would not necessarily be safe at home, because we don't know what the environment is. We don't know what medications they're on. We don't know what medical conditions they have. So we decided not to test the aerobic condition at home, just to test flexibility, balance, and strength.
Thank you.
Any other questions? Well,
so I want to add that I sent my presentation to Shmita Singh, and I did that on purpose so that you would have access to all the links. If you would like to use any of those materials with clients or patients of yours, feel free. And that's why I did that, so that if they would be useful for you at all, you're certainly welcome to use them. And if you have questions that you think about later, you can always send me an email.
And we have the references, Rona, which we have sent. We'll be displaying on the board as well today. And if anyone wants, we can share them by mail also.
Perfect.
Yeah.
I also sent a reference list. So we're very big on evidence-based practice. So for the little evidence that we currently have that's global, I sent that list to Shmita Singh as well.
Yeah, Chandni, could you please show the references? You can put that in chat box too.
Yeah, sharing that. Give me a minute, please.
Yeah.
So I thank you all very much for your attention. I think, unfortunately, as the pandemic goes on, we will get more and more information about this population. But I think we know enough now to be concerned, certainly.
Yeah, thank you so much. Thank you so much, Dora, for such an informative session. And we are looking forward to meet you again. You always rock as usual. So even when I started working with Special Olympics, what I learned was that those athletes were not disabled. They were super abled actually. And the Olympics in general, when we say that heroes are made there, whereas when we talk about Special Olympics, here heroes come. And life is all about balance. So since I have one leg damaged, unless and until I met an accident, I never understood this. When I recovered, I understood this well. And disability is natural. We must stop believing that disabilities keep a person from doing something, because That's not true. And yes, having a disability does not stop me from doing anything with God's grace. So the human spirit is one of ability, perseverance, and courage that no disability can steal away. Now, I call upon Dr. Narendra Sinha, sir, President IAP Bihar, to express our gratitude as well. And the basic pillar of Bihar chapter establishment of IAP and person who is always to help around is Dr. Naren Sinha, sir, who is always guiding us. So I would request him to come up. Good evening, sir.
Good evening. Thank you. Good evening to all. Our chief guest, Dr. Sanjeev Kumar Jha, President IAP, Dr. Ruchi Varshney, National Head IAPWC, Resource Person Dr. Donna Benbridge, Dr. Reena Srivastava, East Zonal Head IAPWC, Moderator Dr. Smita Singh, State Coordinator IAPWC, and all the participants. I wish you all a happy World Physiotherapy Day. It is my privilege to propose a vote of thanks and acknowledge the contribution of those who worked hard to make this webinar a successful event. I express my sincere thanks to the resource person, Dr. Donna Benbridge, for the wonderful and informative presentation on topic of COVID-19 and intellectual disability impact and solution. I would like to express my sincere thanks to Dr. Sanjeev Kumar Jha for giving his contribution for the physiotherapy profession. I would like to express my gratitude to Dr. Ruchi Varshney for providing encouragement on making this webinar a success. I am also very grateful to Dr. Reena Srivastava for her contribution and role in the making this webinar an informative session. My special thanks to Dr. Smita Singh, Dr. Joshni, and all the team members of the IAP Women's Cell Bihar chapter for organizing webinar and putting all efforts for making it successful. My best wishes to all of you. Thank you very much.
Thank you. Thank you so much, sir. We have been fortunate to have Dr. Reena Srivastava, our zonal head here. You have been a constant support and you have given us a lot of encouragement. So over to you, ma'am. Good evening, ma'am. Reena, ma'am, are you there? I guess she's having some problem. Anyways, there is currently insufficient evidence on safe and effective interventions for management of COVID-19, as already explained by Donna ma'am. So long COVID symptoms and impairments or disabilities, when we talk about, the World Health Organization has called on countries to offer people living with long COVID more rehabilitation. Still, we have to go long way before we start up new beginning. I thank all the participants for their presence. You always help us to carrying out such important events. And once again, thanks to IAP Digital team for standing behind like a backbone. Nothing in this life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less. So be informative, be prepared, be smart, be safe. Be ready to fight COVID-19. Thank you. We'll meet again.
Thank you, Dr. Dona ma'am, for being here with us, and Dr. Smita Singh. And this webinar was live streamed on our IAP YouTube channel, IAP India, and it was also live on Zoom. And all the viewers, thank you for staying here with us. And you can please like and subscribe us on our social media platforms to remain updated with the latest webinars. And we are having many more upcoming webinars in the coming days. So please stay tuned with us.